Hi, my name is Maggie, and I'm part of the TESS Research Foundation. I have two siblings with SLC13A5 Deficiency. People with SLC13A5 Deficiency have trouble speaking. And to help with that, my brother and sister go to speech therapy a couple times a week. Today I will be meeting with Hannah, one of my brother's speech therapists. Hi Hannah, is it okay if I ask you a few questions today?
Sure.
First of all, what is a speech therapist?
So a speech therapist is someone whose job it is to help people communicate, which is a basic human need and right, actually. So my job is to help somebody learn how to speak, and if they're having trouble speaking, then I find some other ways for them to communicate. Kids with this deficiency often understand almost everything, sometimes everything that's being said to them, right? Do you know that about Colton, right?
My brother, he totally knows what we're saying, but he can't really respond to that.
Right. So speech therapy is not just speech therapy, it's about overall communication.
What exercises do you and my brother use, and how does it help?
We work on speaking and other ways to communicate. So one of the ways that we work on the speaking part is I actually physically help him to know how his mouth should move and how his tongue should move. A couple of the words that we've worked on is, actually I taught him how to say mama, and now he says it all the time, right?
Yeah.
Okay, but how we did that is I actually helped him with his jaw. Can I do it on you? Mm-hmm. Okay, so one of the ways we do that is something that's I'm trained in called prompt. I'm gonna hold this and I'm gonna put my hand on your say and say Okay, so that's one of the things. And then to drop his jaw, I help him. See? Can you hear that? So say ma, ma, ma. There you go. Now you can say mama. So that's one of the ways. And then I give him other ways to communicate. So for example, he can't say Colton. Those aren't sounds that he can say yet.
Yes.
So we have sometimes low tech and high tech and pictures and all kinds of ways so that he has a voice and is able to express what he wants to say. One of the ways we do that is take these little buttons and we can record a message on it. Yeah, you're trying to say Colton, so remember, here's your button. Hi, my name is Colton. And then they know his name is Colton. He gets very happy when he's able to express that. Another way that he can communicate is we have this very high-tech device, and this has a lot of different words, categories, and all kinds of things that he might want to say. Here's your talker. You want to say anything? You want to tell somebody to stop? Can I help you say it?
Yeah.
Okay, here we go. Ready?
Stop.
Stop! So he has a lot more possibilities.
Clear.
And this is probably going to be his main way of communicating for a long time. Like if he says no.
No.
Yeah. But you know the other words he can say. He can say yeah.
Yeah.
Right?
He can say yeah, he can say no.
And then one last thing I'll show you. So sometimes we have visuals like this.
Whoa.
So this is other things he could point to the pictures once he's learned what they mean. Me, your turn. Your brother loves to talk and he wants to talk. So this is not his favorite thing to do. He'd rather have an actual voice. So that's why for your brother, it's been most successful to have things that actually speak for him.
I bet you I know I like to use my actual voice.
Yeah.
So I bet it's hard for him to he can use it in some ways, and he's still learning. My sister can probably say a little more than him because she's 15.
That's right.
He's basically like every other little boy, but can't do stuff as easy. Maybe it's a lot harder for him.
That's right. But he works really hard every day and he understands it. So there's a lot of ways, and again, if you look at speech therapy or communication in general, we remember that these kids often understand a lot. So we just can't judge them by how they look or how they're acting or what they can't say. And so my job is to really try to find any way and every way possible for him to be able to have a voice and communicate his feelings, his wants, and his needs.
Thank you so much for coming in and teaching me about speech therapy. I really learned a lot.
Well, thank you for having me. All right. Right here.
Go. What?
Do you want me to go now?
Yeah.
Okay, bye.
Bye.
Okay, bye-bye. See ya. Bye, Colton.
Thank you so much for watching this video. Go to tessresearch.org for more information. Hope to see you later.